Next, it is my pleasure to introduce Dr. Sherilee Harper. Dr. Harper is an assistant professor in the Department of Population Medicine at the University of Guelph. She is part of an international research initiative called the Indigenous Health Adaptation to Climate Change Project, which works closely with Indigenous peoples and their organizations in the Canadian Arctic, Ugandan impenetrable forest, and the Peruvian Amazon. The project aims to combine science and traditional knowledge to strengthen health systems in light of a rapidly changing climate. Her presentation today is called Climate Change and Indigenous Health in 3 Regions, Uganda, Arctic, and Peru. Please join me in welcoming Dr. Harper.
Okay, so first of all, thank you so much for inviting me here today. I'm really excited to be here. It sounds like it's a really, obviously an interesting and diverse panel of speakers, but also the audience and the delegates of the conference sound very interesting too, so it's my pleasure to be here today. So yes, I'm here to talk about climate change and Indigenous health, and the information that I'm going to present to you today is not just from my own work, but it's from this team of great people's work that are part of the Indigenous Health Adaptation to Climate Change Project. So I want to introduce these people because this is just not my own work. First we have Dr. James Ford at McGill University. He's a geographer and his expertise is climate change adaptation. Dr. Leah Barang-Ford is a health geographer at McGill University. There's myself, I'm an epidemiologist by training. Dr. Victoria Edge, who's at the Public Health Agency of Canada. Dr. Schwab Lowassa, who's a geographer at Makerere University in Uganda. Didas Nemanja, who's part of the Ugandan Ministry of Health, so he's also a policymaker. Alejandro Llanes, who's a medical doctor and epidemiologist at a Peruvian university. And Dr. Cesar Carcamo, who's also a physician and epidemiologist. So together we've been working for the past 5 years on this project called the Indigenous Health Adaptation to Climate Change Project, and that's what I'm going to present to you a little bit about today. So we work in the 3 regions, but most of my presentation is going to focus in the Arctic, which is where most of my experience comes from. So before we get there, I'd like to give you a sense of context. So first, by raise of hands, has anybody been to the Canadian Arctic before? Okay, so quite a number of people, that's great. Anyone from the Canadian Arctic? Any Arctic residents? Okay, so for many of you in the room, this won't be hard to do, but I'd like you to just take a moment to imagine. I want you to imagine that you don't live wherever you live now in southern Canada. Imagine that you're not sitting here today, but instead that you're somewhere in the Canadian Arctic. So from west to east, we have the Inuit regions Inuvialuit, Nunavut, Nunavik, or Nunatsiavut. Imagine how the landscape is really different. There's small, rocky bodies of land separated by really large waterways, and all the communities are coastal. Imagine that because you live in these coastal areas and you live so far away, so far north, there's no roads going into or out of the community. That means that everything that enters the community has to enter either on plane, on a year-round plane service, or a couple months a year by ferry. In the wintertime, the way that you access traditional lands and hunting grounds is by skidoo over ice and snow. And some people continue to use traditional dog teams, which the Inuit have become internationally famous for. In the summertime, which is only a few months of the year, imagine that those large bodies of water that are ice in the winter open up, and now new hunting grounds or fishing grounds are available by boat. Imagine the close relationship that you have to have with your environment in order to survive. It's quite amazing that this culture has survived in the Arctic for centuries, living in really frigid temperatures. Minus 50, minus 60 is not uncommon in February. Imagine the close relationship that people have to have with animals to survive. So all of the food in the grocery stores, in the wintertime anyways, has to be shipped in by plane. It has to be flown in there, so it's incredibly expensive. So most people still rely on food from the land for subsistence. So these are people who are still relying on the land for survival. While most people have access to tap water, many people prefer to drink brook water that's untreated. So even when they're in the community and they have access to tap water, they prefer to go to local brooks and streams like these two men here, Carl and his father-in-law Hooker, who are out on the land getting water to bring back home to drink at their house for the rest of the week. And when people are out hunting or trapping or at their cabins, there is no tap water. So people rely on these brooks and streams to drink this water untreated. And imagine how fast things are changing in the North. And they're changing for a lot of different reasons. They're changing for social, cultural reasons. They're changing because of the fairly recent introduction of the wage economy. But they're also changing because of climate change. And that's what I want to talk to you today about, are some of these local observations of how climate change are impacting the people in the Arctic and how these impacts are impacting their health substantially. So for the rest of my presentation, I'm going to mix some of the words and voices from Inuit from the Arctic regarding their observations on how climate change is impacting health, and I'm going to supplement that with some published studies as well. The first area that I'd like to talk about is food security, then water security, how climate change is impacting mental health and well-being in the Arctic, how it's introducing new hazards and safety concerns, and finally how it's beginning to impact healthcare service delivery. So to start with food security, this is a photo of Jack Shywalk, and he's preparing a duck right now. So, you know, it won't be surprising that if the climate is changing and that if ice regimes are changing, the ice is forming later in the year, it's breaking up earlier in the year, it's increasingly unsafe to travel over that ice. It's not surprising then that hunters are having a more difficult time accessing hunting grounds to go hunt and bring food home and put it on the table. Furthermore, they're reporting that migration patterns of different animals are changing. So where animals used to be, they're no longer anymore. And that's impacting food security. And that's important because food security in the Arctic is already an issue. So we know that when we compare food security in the rest of Canada to the Arctic, the rates of food insecurity for Inuit are about 5 to 7 times higher in the Arctic already. And then when you add the impacts of climate change to this, it exacerbates food insecurity even further, which has obvious impacts for nutrition, childhood development, cognitive function, and so on. And for example, we know that science has certainly backed up these stories from Inuit hunters. So here's a map of where the caribou used to be in the eastern part of the Arctic. And we can see now that the migration pattern has changed. So the caribou are moving more northeast, and they're harder for Inuit hunters to access. And their numbers are declining. And right now, the numbers of caribou are so low that there's a hunting ban in this region on caribou, which substantially impacts food security for this area. So moving on to water security, and water security is probably one of my personal areas of passion. When you talk to Inuit people in the Arctic, they'll tell you that the water's changing. So fresh brooks and streams where people used to collect water for drinking no longer exist. They're starting to dry up. The water quality is changing. Caves where people used to go and get year-round ice to keep food cold at their cabins, all that ice is melted. These are changes that have never been observed before through generations and generations of oral histories. And this has obvious impacts for health too. Changing water quality and quantity obviously impacts health. And some of the research that we've done has shown that after a period of heavy rainfall or rapid snowmelt, on the same day we see increased levels of indicator bacteria in that water. And about 2 weeks later, we see a significant increase for clinic visits for diarrhea and vomiting in the Arctic. So we can see that under these weather conditions, we're expecting increased clinic visits for diarrhea and vomiting, and under a variety of different climate change scenarios, we're expecting to see these different weather events to increase in the future, so we expect that climate change will impact diarrheal disease in the Arctic. There's also a lot of new hazards and safety concerns, and this has a lot to do with the ice. So hunters and family members are reporting that the ice is no longer safe. It's hard to know which areas will be safe to travel on and which areas won't be safe to travel on. Areas that used to be safe to travel on for generations are no longer safe. It's harder to predict where it's going to be unsafe or safe. People are reporting increased snowmobile loss, snowmobiles falling through the ice when people are out hunting. And this increases hazards. So a study that was done in Alaska looked at the relationship between unusual weather events and changes in travel plans. So if an unusual weather event happens when you're out on the land, you have to adapt and respond and react to that and change your travel plans. And those changes in travel plans were significantly associated with increased injury out on the land, as well as frostbite. Mental health and well-being is a huge one, and we're only really beginning to understand the impacts that climate change will have on mental health and well-being. In the Arctic, perhaps it's a little more clear because Inuit people have a really close relationship with the environment, and it's a part of their culture and their identity. So if the environment and the ability to provide food for your family through hunting and fishing builds your sense of identity, if that's taken away from you, obviously that has impacts for mental health and well-being. We know that it impacts genders differently. So in the rest of the world, it's interesting because a lot of the climate change narrative is that climate change will have impacts on more so on women. So climate change will be impacting women more than men. But in the Arctic, we see something slightly different. It's men who are out hunting and gathering and are taking increased risks to go and hunt for food. And they're the ones that are experiencing a lot of climate change impacts right now. So this is a graph showing search and rescue calls. So we see that search and rescue calls due to unsafe travel conditions are primarily made through men who are stuck out on the ice. But what we also see is that women are impacted, but in a different way. So if it's your brother or your son or your father who's out on the land for weeks and months, and you don't know whether they're safe or not, and you know that ice patterns are changing, it increases a sense of worry and concern that you don't know if they're safe or not and if they're okay. So we have significantly more women report worry, anxiety, and stress about changes in climate compared to men. Okay, healthcare service and delivery. We're only starting to really understand what these changes mean, but a variety of different health workers, so physicians, nurses, policymakers, decision makers in the Arctic are reporting that the increases in weather storms, so blizzards or fog coming in or things like that, those events are increasing because of climate change, and that makes it hard to provide healthcare services for the North. So if somebody's having a heart attack in the community and all of a sudden the weather's down and you can't get a plane up there to bring that person south, that person's going to be having a heart attack in the community without the support that they could have had if that weather wasn't like that. Now, people working in the Arctic have always had to deal with weather. This is not new. But what's new is the increase in frequency of these storms and the duration of these storms, or when communication lines are down. So the occurrence of this is increasing. So, that's what's happening in the Arctic. But what's really interesting through the IHAC project, we found that this is happening in all three regions. So the way that climate change is impacting Indigenous people in the Arctic is the same way that climate change is impacting the health of Indigenous people in Uganda and Peru. So I told you about the Inuit, but the same situation is true for the Ugandan Batwa that we've been working with. So the Batwa are traditionally a hunter-gatherer people who only recently, in the past 20 years, were evicted from their forest, where they've lived since time immemorial. And they've been forced to adopt an agrarian lifestyle, which has obvious implications for food security and nutrition. But when you consider the climate change impacts that these people are experiencing, it's exacerbating the hardship that many of these people are facing. In Peru, it's the same thing. We've been working with the Shipibo and the Shawi in the Amazonian forest, or the Amazonian jungle. And we're also finding that climate change is having substantial implications for them as well, in the same way that the Inuit are facing these changes, particularly around food security and also malaria. So while these three regions are really different, the culture is different, the language is different, the climate is certainly different, what we're finding is that the underlying relationships between climate change and health for these Indigenous people are the same. And we went through all of them, but what's really interesting is that these aren't just, Indigenous problems. These aren't just Indigenous concerns. These are international concerns. And I can show you a similar graphic about the way the World Health Organization is projecting that climate change will impact international health, no matter, for Indigenous people and non-Indigenous people. And it's actually quite similar. So these aren't just Indigenous issues, these are international issues. So with that, I'll thank you. But before I do that, I just want to put in a plug. One of our students is about to release a podcast looking at the topic of water. And it's a really great podcast. It's integrating Indigenous and Western science together. It's looking at environmental issues, and it's going to be released on Friday. I've heard the first cut of it, and it literally moved me to tears, so I just wanted to advertise it. You can access the podcast live on Wednesday at this website, or follow the Twitter conversation at #H2O Dialogues. So thank you very much.